for most of what you guys are going to see in the hospital, is mostly going to be infection or trying to aspirate a knee for an infusion. You want to know what's going on. So usually what will happen is, here's the tibia and fibula on the side profile. I'll usually start on the lateral side here. If it has an effusion, this patella gets pushed out of the patellofemoral groove. And there's a little area above the knee called the suprapatellar pouch, and that usually can hold a lot of fluid, and it's a nice, easy target. So what I like to do is find the superior pole of patella, and then I'll come down a little lateral and maybe a little bit superior to that. And then I'll take a needle and kind of inject or aim it just about like, where's that needle at? I'll take a little needle and aim it about like that, And if you're in the hospital and you have these ultrasound machines, you should definitely be able to see the suprapatellar pouch. It'll be an easy spot to look for an effusion. So I'll aim like that, and then when I go in, I'll aspirate. And the one thing I see happen a lot of times is you go in there and you're in the right spot, you aspirate, nothing comes out, and you're like, what the heck? So what I'll do is rotate the needle 180 degrees, because there's a bevel on this needle, and sometimes that bevel will get caught in like some fat or whatever. It's up above your synovium, and it won't aspirate. But if you roll it around a little bit, move it around just a little bit, you'll start getting some fluid off of it just by moving it around. And then once the fluid starts to come, just keep it right there and pull it all out. If you think it's gout, you have a strong suspicion for gout, and it's not, you don't suspect infection, then you can a lot of times just leave this needle in place, and have your steroid shot ready to roll. Just put it in there and inject it. So I do that a lot of times in the hospital where I have a strong suspicion that it's gout. I'm aspirating it anyway. We're already going to be there. Patient's not walking. They're going to be a tough discharge because they can't ambulate. So I'll go ahead and put a steroid shot in there, make them feel better, and get them moving.